Aloha and welcome everyone. I want to start by thanking Navian Hawaii for sponsoring this community connection education series. It's really a great resource for caregivers. I also need to make a little plug, a little commercial for my sponsoring organization, AARP Hawaii. As I hope you all know, AARP is a nonprofit, nonpartisan membership organization dedicated to improving the lives of those 50 and over. And it does that through programs like this. It does that through providing resources and benefits, and of course, advocacy for older Americans. So if you're not a member of AARP, I would urge you to consider joining up and being part of the movement and helping support that mission. So I want to welcome you to Medicare 101. We're going to cover today, oops, Debbie, my slide is not moving. So would you mind advancing can you advance?
There we go.
Oh, there we go. Okay, let me get my cursor there. Nope, still not.
Okay, I will control it for you.
Okay, next slide. Okay, so what we're going to cover in our time today is the basics about Medicare, what it covers, what it doesn't cover, some of the costs, so you have an idea of what Medicare may cost you out of pocket and how to avoid some of those costs. I'm going to talk about choices. You get to make a number of choices after you enroll in Medicare about how you want to receive those benefits. So we'll cover those. And then we'll end up providing you with resources, both websites and phone numbers where you can go for additional information or where you can get help in accessing Medicare. So next slide, please. Okay, what is Medicare? It is a federal health insurance program that was created in 1966. So it's of Medicare and AARP age itself. It covers people who are age 65 and over, people under 65 with certain disabilities, and any American of any age with end-stage renal disease. That means they're undergoing dialysis or awaiting a kidney transplant. So next. So important to understand, especially for those of us who are used to employer-sponsored health insurance, things that Medicare does not cover. Things that we're used to, like vision, dental, hearing coverage. Medicare does not cover any care outside of the United States. So we'll talk about some ways you can get those things covered, but you need to be aware that it's not like the health insurance that you're likely to have through your employer. You will be responsible under Medicare for monthly premiums. That's the amount you pay every month or annually just to have the health insurance. You'll be responsible for deductibles, which is an amount you have to pay before health insurance coverage kicks in. You'll pay co-insurance, which is a percentage of the cost for some services, or you'll pay co-payments, which is a fixed amount of dollars for a service, such as a copay for a prescription drug. So those you're probably familiar with because those are typical in our current health insurance programs. Next, Deb. Okay, Medicare is a program that was created by Congress. Therefore, it is complicated. So we're going to talk about three parts of Medicare, which are the actual insurance coverage. Part A, which is hospital insurance, Part B, which is medical insurance, and Part D, which is prescription drug coverage. There is a Part C, and we will talk about that, but that's really not insurance coverage. It's a choice you get to make about how you want to receive Part A, Part B, and Part D. So, but we will talk about Part C as well. Next. Okay, so Part A. Part A covers or helps to cover the cost of inpatient hospital care. So in addition to providing some coverage when you're admitted to a hospital. It also includes some skilled nursing facility care after a hospital stay. And it is the part of Medicare which covers hospice and some limited home health care if you qualify for that. So next. So Part A costs for 2021. Most people do not pay a premium for Part A. You've been paying Medicare taxes as part of your payroll taxes while you've been working. And as long as you have 10 years or 40 quarters of contributions through your Medicare deductions on your payroll taxes, you'll pay no premium for Part A. You've already paid it. If you don't have those 40 quarters, you can still buy into Part A by paying a premium. Then you have a deductible. And the current for this year, the deductible for a hospital stay, a hospital admission, is $1,484 for a 60-day benefit period. After that 60-day benefit period has expired, and if you're admitted again, you pay the deductible again. So this can add up if you're admitted frequently to the hospital. You also will pay a copayment. Nothing for the first 60 days, but unfortunately, if you're hospitalized for more than 60 days, you'll be paying $371 for days 61 to 90. If you're hospitalized for longer than 90 days, the copayment goes up to $752. But these are for your lifetime reserve days, and you only have 60 of those for your lifetime. And after you use up those days, you have to pay all costs. So hospital care under Medicare can be somewhat expensive, and we'll talk about some ways you can mitigate those costs. Next. Let's pause, and before I go on to Part B, are there any questions about Part A? Do we have any questions, Debbie?
No questions right now. If anybody has any questions, feel free to type them into the Q&A
Yeah,
box.
feel free to type them in as we go along, and we'll come back at the end and make sure we've addressed all questions. Okay, Part B covers your medical insurance. This is what the part of Medicare that covers cost of your doctor visits, outpatient hospital services, some durable medical equipment that's medically necessary, Medicare approved preventive services. And one of the things the Affordable Care Act did was it made preventive health services available at no copay. So for example, your COVID vaccinations have no copay in Medicare, they're free. Things like mammograms, colorectal cancer screening, all of those services, flu shots are free under Part B Medicare. Medicare also added a benefit in 2021 for telehealth services so that you can visit your doctor virtually and have that visit covered. It's a new benefit in 2021. Let's go on. So under Part B, you pay a premium, and that premium for this year is $148.50 a month. If you have higher incomes, individuals who earn more than $88,000 or couples more than $176,000, you will pay higher premiums. So, but the basic premium is $148.50 a month. If you're already taking Social Security, that premium is deducted from your Social Security check. If you're not taking Social Security, then you pay this directly to Medicare. There's an annual deductible for Part B. So before Part B pays anything, you have to pay $203 this year out of pocket. And then for most Part B services, you pay a coinsurance of 20% of the Medicare approved cost for those services. Medicare covers 80% and you pay 20%. Okay, next step. Okay, any questions about Part B before we jump into prescription drug coverage? No questions. Okay. Then let's talk about Part D, prescription drug coverage. This was a benefit that was added to Medicare in 2006. And it is also a very complicated benefit, although it's getting simpler with each year. So Part D helps cover some of the cost of prescription drugs, and it is not run by Medicare. It's run by Medicare-approved private insurance companies. Next. So what Part D covers? Each plan will have a list of covered drugs, which we call the formulary. The formulary must cover at least 2 drugs in every drug class. So you'll have access to all drugs, but maybe not the drug that you're taking on some plans. So the formulary must include both brand name and generic prescription drugs. Typically, plans place these drugs into tiers, and the cost you pay depends on which tier the drug is in. So generic drugs typically are tier 1, have the lowest copay. Tier 2 will be the brand name drugs that are on the formulary. Tier 3 may be brand name drugs that are not on the formulary. And there may be a tier 4 for certain high cost drugs or injections where you're going to pay a co-insurance rather than a copay. So that's typically how the formularies work. Next slide, please. So people in Part D may pay a monthly premium, which in this last year averaged about $30.50 a month. But there are many Part D drug plans which have no additional premium. You may pay an annual deductible up to $445, but again, many of the plans that are offered, particularly here in Hawaii, will have a much lower deductible. And then you will pay typically a copayment when you get your drug from the pharmacy or co-insurance. And again, like Part B, people who have higher incomes will pay a higher Part D premium. Next slide. This is one of the complicated things about the Part D benefit. It's called the donut hole. And when the Part D benefit was created, when you fell into the donut hole, you had no drug coverage. The Affordable Care Act is fixing that, and eventually the donut hole will go away. So let's explain how this works. You have an initial benefit period where you will pay first your deductible, then your insurance, your drug coverage kicks in, and you'll pay either a copayment or current co-insurance for your drug. When the drug costs, your total drug costs reach $4,130. That's what's paid by the drug plan and you out of pocket. Then you're going to enter into this donut hole where you're going to pay 25% of the cost for a brand name or a generic drug. Until once you have paid $6,550, you then reach the catastrophic benefit and you will only pay a copay for those drugs. It is a complicated benefit, but again, within the next, I believe, 2 years, that donut hole is going to totally disappear. So that's good news. Next. So any questions about Part A, Part B, Part D before we go on to Medicare choices? Okay, let's move on then. So when you enroll in Medicare, you have a choice about how you want to receive your benefits. And one is you take what we call original Medicare. That means you sign up for Parts A and Part B and start paying your Part B premium, and Part D if you want prescription drug coverage. Now, you can delay that, but if you do, you're going to pay higher premiums later on if you enroll later. So the conventional wisdom is sign up for Part D when you sign up for Medicare. Then you also have the option under Original Medicare to get a supplemental plan, or what's called a Medigap policy. And I will go through how those work. Those are a plan which helps cover your out-of-pocket expenses for Parts A and Part B. So that reduces your out-of-pocket expenses, but you pay an additional premium for that. And we'll talk about that. Your other choice is, instead of going the original Medicare route, is to take Medicare Advantage, or Part C, which is a health plan that combines Parts A and B, and usually Part D, into one plan, one-stop shopping for all three. So let's take a look at those. So Original Medicare is a fee-for-service plan. You go to the doctor, or you receive a service, Medicare will pay its portion, and then you will pay your share of the cost for that service. It includes Part A and B all the time. You can go to any provider that accepts Medicare, and you must choose and join a Medicare prescription drug plan separately if you want to get prescription drug coverage. Next. Then you also have the option of getting Medigap coverage, which is a supplemental health insurance policy. It's sold by private insurance companies that are approved by Medicare. It covers gaps only for Original Medicare. It doesn't work with a Medicare Advantage plan. And it generally covers some or all of your deductibles, your coinsurance, and your copayments. Sometimes it adds additional benefits. It will have emergency coverage for care received outside the United States. At least some of those plans do. There are up to 10 standardized plans. They have letters, A, B, C, D, et cetera. So you can look at a plan A and look at everyone who offers that plan, say here in Hawaii, and look at what their premiums are and how their costs for that plan. So you can compare those plans and make an educated choice about which one you might want to get. And I'll show you where to find those plans in a little bit later. Next, Deb. Okay, you can buy a Medigap policy within 6 months of enrolling in Part B. You must be 65 or older. If you wait more than 6 months, the Medigap plan can charge you a higher premium or refuse to cover you. So if you're going to go this route, you need to make that decision early on. You'll pay a monthly premium, but the Medigap policy does not apply to prescription drug costs. It only applies to Parts A and Part B. Next. So then we can talk about Part C, which is an alternative to Original Medicare. These are health plans that are offered by private insurance companies. They all include Part A and B, and almost all of them bundle in Part D. And they often provide extra benefits that Original Medicare doesn't cover. Many of them offer vision, dental, hearing. Some offer chiropractic and acupuncture benefits, and many of them will cover care outside of the United States. So it is well worth taking a look at a Medicare Advantage plan if you're interested in some of those additional benefits. So let's continue. So Medicare Advantage plans do have some restrictions. You have to live in the plan service area. You may have to use the providers only in that plan's network, and you may pay an additional premium in addition to your Part B premium. Although I will show you how to find those plans here in Hawaii, there are many plans that charge no additional premium, to be part of that plan. So Medicare Advantage, you still are going to pay monthly premiums. You still have to pay your Part B premium. In fact, you have to be enrolled in Part A and Part B to be eligible for a Medicare Advantage plan. You will have a deductible, that deductible can't be higher than original Medicare's, and it's often lower. You will have potentially co-payments. You may have to follow plan rules about using only the plan's network, but you may also be entitled to extra benefits like vision, dental, hearing, and other extra benefits that are not available through original Medicare. Next. So before we go on, any questions so far about Part C or Part A, B, and D? Okay, no questions, great. Okay, so when do you enroll in Medicare? If you're receiving Social Security already, if you decided to take Social Security early, you are automatically enrolled in Medicare at age 65, except in Puerto Rico. I don't know why that is. But anyway, you're enrolled in Medicare. And if you don't want it, you may have to contact Social Security and say, no, not yet, because if you're already involved getting health insurance through an employer or a spouse's employer, you may not want to enroll in Part B because you're going to be paying a premium, which you're really not going to use. So you can enroll 3 months before, during the month of, or 3 months after the month you turn 65. So you've got a 7-month window of when you can enroll in Medicare without any penalty. If you delay enrolling in Part B outside of this window, you run the risk of paying higher premiums for Part B, up to 1% a year. So you want to enroll when you're eligible to enroll. There are special enrollment periods for people who are over 65 and transitioning from employer-sponsored health coverage. So again, if you already have health coverage through an employer and you're still working, or you have it through a spouse who's still working, you don't need to enroll in Part B when you turn 65. It's good to enroll in Part A because you don't pay any premium for that. But you can delay enrolling in Part B until that employer-sponsored health coverage ceases, and then you have 8 months to enroll in Medicare without penalty. Next. There is also an annual open enrollment for Medicare. So each year, and it usually runs from mid-October to early December, you can change your Medicare choices. So during that open enrollment period, you can switch from original Medicare to a Medicare Advantage plan, or vice versa, go from a Medicare Advantage plan back to original Medicare. Or you can switch your Medicare Advantage plan to a different plan. If you're not happy with the one that you have, you can switch to another one. So that opportunity presents itself every year, and those changes will become effective on January 1st. Next slide, then. So where do you get information about Medicare? Medicare.gov is a great website. Let me see if I can show this. Yeah, my cursor, I hope, shows up. You can sign up under this box. You can change plans. If you click on this box here, the sign up change plans, there'll be an option of looking up plans in my area. You enter your zip code and it will show you all of the health plans available. So I enter my zip code and it shows me there are 15 Medicare Advantage plans available here on Oahu. It will also ask you if you want to enter the prescription drugs you're taking. And if you do that, when it shows you the plans, it will estimate your out-of-pocket drug costs for each of the plans and allow you to compare those. So as I said, there are 15 Medicare Advantage plans available here on Oahu. Many of them have no additional premium. You will also see for each plan its star rating, which is Medicare's way of rating the quality of those plans. Goes from, well, you can't have less than 2 stars to be on the website, but it goes from 2 to 5 stars. Happens that the Kaiser Senior Advantage Health Plan here in Hawaii is the only 5-star plan, but it also charges a premium. So you can evaluate that choice for yourself. Many of the other health plans that are offered by other names that you'll recognize, of course, HMSA, mentioned Kaiser, Humana, United Healthcare, have 4-star health plans. Some of those have no additional premiums, and they also offer additional benefits. So you have the opportunity on this website to look those up and compare them, understand what your out-of-pocket costs will be. So let's move on. Another resource for you in navigating Medicare is the State Health Assurance Assistance Program, which is at hawaiiship.org. Their phone number is here. It's a place where you can go and ask questions. You can talk to a navigator who can help you navigate the complexities of enrolling in or changing Medicare plans. So it's a great local resource. Next. Again, just to reiterate, Medicare is at medicare.gov. You can also call them for assistance. Social Security Administration is one of the places where you can sign up for Medicare. So socialsecurity.gov and their phone number, and the State Health Insurance Assistance Program, hawaiiship.org. Okay, next. You know, AARP also has a very useful Medicare tool on AARP.org. They have a Medicare Q&A tool where you can ask questions and get answers for most of the commonly asked questions about Medicare. So that's another valuable resource for you to access. Okay, so that's everything about Medicare 101 in a brief presentation. Let's see if we have any questions. Anybody typing in any questions that we can answer?
So if anybody has any questions, please type them into the Q&A box. We currently have no questions. So we can wait another minute or so, but
yeah, we'll give people some time to be sure don't be bashful. You can type it in so we don't show your picture on the screen.
Or you just did a really good job explaining Medicare.
I know you did get a question, Debbie, in advance that somebody asked, if I join a Medicare Advantage plan, do I still have to pay my Part B premium, and who do I pay it to? Do I pay it to Medicare, or do I pay it to the Medicare Advantage plan? And the answer to that is yes, you still have to pay your premium. If you're already getting Social Security, you pay it automatically because it's deducted from your Social Security check. But if you're paying Medicare directly, you pay Medicare directly, not the Medicare Advantage plan.
Okay, there's no questions. I guess with that, if anybody has any further questions, you can feel free to send them over at education@navianhawaii.org, and I can reach out to Frank and follow up with him, and he can answer your questions.
Sure, I'd be happy to do that. Yes.
So is there anything else you would like to cover before we wrap everything up, Frank?
No, I think that's it. I think Medicare is a complicated subject, but there are a lot of resources out there to help you navigate through it, particularly Medicare.gov. And then the Hawaii SHIP, if you're still confused and want some help in making that choice. The Medicare.gov really does give you an opportunity to compare the plans, what their additional benefits are, if there are any, what their premiums are, what your estimated out-of-pocket costs are going to be for premiums, for deductibles, for co-pays, and for your prescription drugs. So it allows you to make a very educated choice if that's the route you want to go. For many people, particularly if you're in a retiree plan, Sometimes you want to stick with original Medicare because your retiree plan becomes your Medigap policy and covers most of what Medicare doesn't cover. So, those are all things that you need to weigh in making your decision. And for that, you may need to talk to your retiree plan. I happen to be a retiree and through my spouse have the state retiree plan, which is a very nice plan. So it covers most of what Medicare doesn't cover. So those are all factors that you need to consider in making your decisions.